If a pandemic emerges in our region, it is hospitals that will be on the front lines. According to the University of Maryland Center for Health and Homeland Security, which helps businesses and governments plan for the worst,
I think right now the most important thing is vigilance through surveillance.
the center's health director, Trudy Henson, says right now hospitals and even urgent care centers and family doctors need to be screening.
Hospitals are the ones that are going to be having those patients present. They're the ones that are going to be screening the patients. They're going to be the first sort of alarm to say, we think this person might have coronavirus. They have a great responsibility to identify and then protect and isolate, and then also communicate with other hospitals.
Henson says look for hospitals to cancel elective surgeries and other routine procedures if the patient load surges any higher than 20 to 30% above normal. She says local health officials should be prepared to consider school and workplace closures if absenteeism rises by similar figures. And Henson adds, states should be prepared to deploy Homeland Security stockpiles of face masks, gowns, and even prepare to activate mobile field hospitals to help healthcare facilities set up parking lot triage should a surge of patients materialize. The U.S. Centers for Disease Control is already warning supplies of N95 respirators can become depleted during pandemics or when otherwise in high demand. The agency is urging hospitals to plan for conserving the face mask style respirators should a shortage develop. The CDC does not recommend the use of face masks outside of hospital and workplace settings out in the community, according to an agency advisory. Scott Broom, WUSA 9.